What is cannabis?
What is cannabis is an interesting question because it is a herb, it is a plant. In modern medicine, there are about 40% of the medicines are still plant-based medicine. Anti-cancer medicine, diabetes medicine, they are all derived from plants. Okay, so if you look at cannabis, it's a God's gift because when we compare to what cannabis is to us, it's a big gift of God or the nature, mankind. So why do I say gift? Because most of the things it grows widely without any support, without you even looking after it. It grows widely, right from Kashmir to Kanyakumari, to the west or east coast, everywhere. It grows widely. So that's why it was popularly known as weed, because it grows wide everywhere. And the thing was, in olden days, we didn't have to eat it. We didn't have to consume it. The cattle used to consume, and they used to provide us the needed nutrition through their milk and the products that we use, from the cattle. So that was how initially it used to be. And it grows very fast. It grows quickly. It hardly needs any care. So if you want me to describe cannabis, it's a gift of nature, the same way like humankind is a gift of nature. So same way it is.
That's described so beautifully. And what is CBD?
Okay, so I think that is interesting because that is where people want to know what is CBD. CBD is derived from this cannabis plant, or what we call as in Indian context, the plant of palm. So the plant is taken and the things are extracted. And one of the molecule of the plant is cannabidiol, CBD. So it's simply it is like a steroid-like molecule from the cannabis plant. That is what they thought in 1942, I think. 1942, it was first isolated. And then they didn't want to use it because there were so many other researchers, people who were doing steroid medicine, and it was damn cheap. So they didn't want to include that. But then coming later, in 1960s, they identified, and they said that this is cannabidiol. It is vastly present in cannabis plant, and it has lots of value. The first value they identified was it is neuroprotectant. It protects the brain and the nervous system. So that is where the story starts. So it is like a supplement, and it protects our brain and nervous system.
Really nice. That's very interesting because the brain is where all the messages to the entire body are sent across.
Yes.
Yeah. So how does CBD help in the treatment of most autoimmune conditions, and why is it called the wonder herb?
Okay. So before you look at the herb, you should look at, because I correlated humankind and cannabis both as a gift of nature to the earth, plant earth. So here we have to look at why did I say that? Okay. So our body, functions in a lock and key mechanism. So God has created the humankind with locks, and the food whatever we eat, they work as a key. So these keys, they go and fit in the locks which is there in our body and opens up, and that brings about the functioning of the human.
Correct.
Like take for example glucose, the simplest thing that we understand, right? Carbohydrate. So we eat complex carbohydrate in the form of rice, dal, and that is broken in the mouth, then in the stomach, and then only selectively glucose is taken up quickly. Glucose acts as a key. On the cells, we have glucose receptors, or what we call as glycine receptors. They go and sit on that, and then under the signal of insulin, they open up and the glucose enters the cell. And what does glucose do? As we have studied in our school, it provides us energy. It provides us the needed ATP, ADP. Same way, the whole system, there is something called as cannabinoid receptors. They are receptors which are specifically made by nature in all the living beings, right from the insects till us. So even the animals have, rats have, cats have, dogs have, insects also have, birds also have. They have something called as cannabinoid receptors. Now, this cannabinoid receptor was discovered in 1990, and they could actually create a cannabinoid receptor in the lab because that is the condition where they accept it as a normal physiology. So they created a cell and they could create a cannabinoid receptor there. So we have cannabinoid receptors in our body. Like for example, we have something called as CB1 receptor. Here it is written CB1 receptor, and then it is CB2 receptors. Okay,
Correct.
so these are the two receptors which are present in our body. CB1 receptors are largely present in the nervous system, in the brain, and the spinal cord, and CB2 is present in immune system. If I want to just put it in the short, and then we have endocannabinoids, means molecules that look like cannabis are made by the body. So the two prominent is here. You can see ligands. Ligand is the short name. So one is 2-AG and another is AEA. So these are the two endocannabinoids which our body makes. What does it do? What does it do? So it modulates the appetite. So in simple language, we say eat, sleep, relax, protect, and euphoria. So it day to day, this cannabinoid molecules, both of them, receptors and molecules, they are there in our body. They control our feeding behavior. They control our sleep. They also relax us. They also make us protect. They protect us, the immune system in the CB2 and the nervous system in the CB1. And then euphoria. Now, what is euphoria? If you look at the dictionary, euphoria means exaggerated sense of well-being.
Correct.
How does that happen? I don't know. Like for example, we have pets, and the pet sees the owner and he's so happy, as if he has seen for the first time. But that sense comes from well-being, euphoria. Now, when do we feel this sense of well-being? Like for example, when we go for a morning walk, right? People who go for a morning walk, they'll swear that if they don't go for a morning walk, their whole day is dull. Now, why does that happen? So we call this as exercise-induced euphoria. So when you go for a walk, the body releases AEA in the brain. And from the brain, it comes all across the body and keeps us fresh and happy the whole day. We enjoy whatever we do. We enjoy the talks we do, everything. So when that is happening, so we get in the euphoric state. And so this AEA, which is there, it is also known as Anandamai, because the researchers spent a good 7 to 8 years in UP and research this molecule. And he used to take the blood samples, and he found that the highest levels of AEA are in the saints in UP. So that's why he put that name as Ananda, blissful molecule. And when the AEA is released in the brain, like when you go into the deep states of meditation, we feel internal happiness, we feel relaxed, we feel comforted. And that is what maybe it is described as what Lord Shiva felt after his episode of, the intense episode that he had with the Shakti, right? And then he's supposed to go and lie down in the cannabis plant, and the plant covered him, and the smell, through the smell, whatever the cannabinoids entered in him, it relaxed him. Okay, so that is what the text says. Now you look at what has happened. We have the logs in the form of this CB1 and CB2 receptors. They are there. Now what does cannabis or CBD does? It goes and sits in this receptor. Okay. So if I want to put it like this, suppose this is the cell. I'm exaggerating the cell. So, and this receptor is like this. So you have a mouthpiece and the body through which it enters inside the cell. So on the cell wall is like that. And so the CBD goes and sits here. And it gently tickles or opens the lock in the CB1 receptor. And what actually happens? Our appetite gets modulated, our sleep gets modulated, we start enjoying the life around us. And because of this CBD, it protects the nerves and the immune system. and it keeps us happy. What else you need? So that's why the CBD has become a talk of town in Western world, where it has now become $6 billion industry. So I keep saying in my lectures that to the Prime Minister, I said, Honorable Prime Minister, if you want to really dream about the 5 trillion economy, you should, get the CBD into the market and allow us to use it. And when the people benefit,
And it
they will
has,
see that
I believe, a good growth
the-
in India as well. There are a
yes,
lot of places where
definitely.
the cannabis plant grows, right?
Yes.
Yeah.
All over India, everywhere.
Wow. Can CBD be used in the treatment of cancer?
Yes. Now, what, like, for example, if you look at cancer, cancer is, I wouldn't tell it, call it as a disease. It's like a syndrome. It's like a complex mechanisms because of which cancer becomes what it is, right? So it is partly due to food, it is partly due to poisoning that we do to ourselves, it is partly due to environmental things, and it is partly due to we not being in tune with the nature. So when all these things come together, the body is not able to handle all these poisons. So we have the environmental poisons, we have the poisonous foods that we eat, we have the unneeded. I would put it like, you don't need that food, so we still keep on eating. And so all these things, what they do, it creates an environment where the body says enough. And when the body is saying enough, that is where somewhere the cancer develops. So when you have that, what does that happen? Somewhere the protection mechanisms of the cells have gone down.
Okay.
Right? And what CBD does, it protects cells. So there is something called a cetrimide. You might have heard cetrimide in the advertisement of hair. Funnily, the companies are making cetrimide shampoos and creams rather than they should make cetrimide injections, where we could take cetrimide injection and remain healthier and happier. But we don't do that, right? So the cetrimide is something that keeps the patency, longevity of a cell. When the cetrimide levels goes down, the cancer cell, that cell becomes cancerous. That is one of the reasons I'm giving, apart from the various mechanisms that it's there. So the one thing that we know is somehow the protection mechanism goes down. One. Second thing, the immune system is not working up to the mark. Wherever the cancer is becoming, the immune system has to eat it and throw it away, because that is the usual process. So somewhere the protection as well as inflammation levels go high, because of which the cancer sets in. And then when we take CBD oil, it protects us. It protects the immune system. It protects us from forming the cancer. So then it becomes preventive as well as we can use for the cancer symptoms. Now, what are the typical symptoms that we come to know when we are diagnosed with cancer? Even before we go to the hospital, the first symptom we know is, "Are yaar, dubla ho raha hai. You were so healthy. Now you're looking like a lakdi. Kya hua tere ko? Kuch kha nahi raha, pi nahi raha." And the fellow is little worried. Really? I was thinking I'm going for on a weight loss. Then he goes to the hospital, they do all the tests, and then they say that you have a cancer, right? So if you look at that, appetite is low, the sleep is disturbed, we have lots of tensions, and then that translates us in the form of gastritis. So we feel nausea, we feel uninterested in food. So if you are taking CBD oil, what it does, it enables your appetite just gently stimulates. It enables your sleep, the stress level goes down, and it protects the cells. So if you ask me, yes, it should be actually definitely used as a supplement during the cancer treatment, irrespective of what else you do.
So CBD by itself can be used for treating cancer, or it has to be used with modern medicine?
So I think there are conflicting things that now we have people who should be given the choice rather than the doctors choosing it. So the doctor should give a choice. Like what we do something called as integrative oncology. So we talk to the patient, we do understand whatever their problem is there, and then we tell these are the plans that are available. So you can go for the chemo if needed, you can go for the radiation if needed, you can go for the surgery if needed. And if your cancer is not dangerous, then we have these options. So those options can be like CBD oil. There is other options in the form of vitamin C. There are other options like ozone. There's so many other options, like in the form of the standard treatments like Ayurveda, homeopathy, all diet therapies and all. So if we have a range of things and the person is allowed to select, that is where the cancer treatment actually becomes better. Like, for example, the cancer is in just a moderate state, right? So it is growing in a slow level. So then we have options. Even before we can go for the chemotherapy, we should try these things out. So in such cases, yes, CBD can be taken as a sole treatment under the guidance of a doctor. You have to take a consultation to understand, because not all cancers respond to the CBD oil. Please understand this. Not all cancers respond to it. There are certain cancers that respond so fantastic, certain cancers that don't respond at all, but overall, it always helps. So you should take an opinion of a doctor who knows about CBD and then include it in your treatment.
Lovely. Doctor, is CBD helpful in pain relief?
Yes, I think that is where, if you look at the graph of the pain, right? The graph of the pain keeps on increasing. There's so many things that when I was studying my graduation, we never knew what is fibromyalgia, just for a simple example. And today, you see there's lots of people having fibromyalgia. It's such a dreaded disorders. Now, in pain, if you look at any given clinic, given doctor, I think 70 to 80% of the people come because they have pain, right?
Right.
And if chronic pain is, I think, the biggest morbidity, if I want to put it in that, the performance falls. The person is not able to carry on to the day-to-day work. So chronic pain is really, really, really very bad. And there's so many different kinds of pains, right? So I'll tell you something, like the pain can be from the nerve. The pain can be from the brain itself, like the fibromyalgia is one of that. Then the pain can be due to injury. The pain due to injury, yes, we know, and we have lots of medicines for that. But when the pain becomes chronic, we don't know what to do. Now, that is where this CB1 receptor comes into play. The CBD1 receptor, it has a unique function where it blocks the signal from one nerve to another nerve. Whether it is a good signal or a bad signal, if you ask me, only the bad signals get cut off. Okay, so we call something called as glutamate, MSG.
Yeah.
People, we say you don't consume MSG because of the glutamate. So when you consume MSG, it goes to the brain and it damages the brain because the glutamate causes brain damage. So this CB1 receptor, under the effect of CB1 receptor, it blocks the signal. So it blocks the glutamate from transmitting. So if the glutamate is not transmitting, the pain doesn't get transmitted. So it arrests the pain at the level of nerves first. Second is it can arrest the pain at the level of where injury has occurred. Like, for example, nerve injury or inflammation, sports injury has happened even there. So it has dual action, whereas the normal painkillers, like, for example, that are routinely used, they work only at the site of injury. They don't work at the site of nerves. That's why they use something called as the stronger painkillers like opioids. So in CBD, that the best thing is it works at the nerves as well as at the inflammation. So it gives a good relief. It takes little time because we need the CB1 receptors has to get saturated.
Okay.
The study shows that maximum number of receptors that we have form as CB1 receptors. There's so many that are there across the whole body. So the CB1 receptors should get saturated. That's why when you start CBD oil, sometimes it takes 7 to 10 days for you to get pain relief.
Lovely. So since it is so useful in pain relief, then why is it not available across the counter like in the US?
I think it took a big, if I remember very well, in California in 1998, it was first legalized for certain people, right? Then it became a big row where some of the people who were suffering from pain, they went on the streets, they wrote letters to the government, and it was a collective thing where the California government then decided to, I said, let us open it because there are so many people who need it. I think it's the same, something similar revolution is needed in India. First thing is, like the Delhi High Court openly said that medical cannabis was never banned. So it was, it is, and it will always remain legal. It was never banned. But then why was it not used? It was because of the fear from the companies who were making products out of Ayurvedic products out of medical cannabis. They got scared that what if, the worst thing happens and the law is so bad that it will create a bad thing. But then in 2014, I think one brave heart guy, he went and he said, I want to open manufacturing unit for to make product from medical cannabis. And that's when he went across different states and he got permission in MP. So he was the first guy to start something at the level of CBD oil. And then slowly, as other people started coming, so many other players came. And now I think it's a good market that they have developed. But still, I think at the level of education, we need to reach out to people like such talks across communities. They really help because they create awareness and people don't know. I'll tell in a simple thing, कि आपके खून में भी भांग है भाई. For a simple, even in your thoughts, you have bhang. It is there. It's a normal thing. You don't have to think it in a wrong way. Science proves that. So we have to communicate this to the policy makers. We have to communicate to the politician, and equally we have to communicate this to the doctors themselves because we are not taught. So if that happens, then I think there is nobody can stop it from being #1 supplement as it has become in US and Canada.
Lovely. And anyways, I really like your approach and the statement that you said that, we give the patients the right to choose that, these are the various modes of treatment that you can take. And then, they're given an opportunity. It's not like blindly, you going on eating a crocine, for example, as a pain relief for a headache. Yeah. So that was a really nice thing that you're doing. So, doctor, is CBD addictive?
And that is the one thing that most people commonly ask me. So first thing we have to understand what exactly is addiction. Addiction is a behavior. It is a human or the behavior of a living being. So if they enjoy something, they like to keep using it. So, and we see that there are so many different kinds of behaviors. Some people are addicted to morning walk. If I tell addicted, people say, "Arey nahi yaar, wo to achhi baat." Right? So some people are addicted to prayers, like they need to pray at this time. No, I can't. First, for me, prayers are so important.
Right.
So you have that weightage. So if you have a good habit that is creative for yourself and for the society, then we call it as a habit or non-addictive behavior. But then when it comes to certain things and because of use of that, it is creating a ill effect. Like for example, the alcohol, right? The alcohol is so widely available. We know it is so bad. We fight for the victims, I want to put it that way. Like the husband is drinking alcohol and creating issues. The whole society is, but still it is legal. But when you look at the addictive behavior, there are certain kind of people who get addicted.
Right.
Same thing can happen with CBD oil. Yes, it can definitely happen because the CBD oil gives you that gentle happiness. And that happiness can be addictive for people who are already ill. Like, for example, if a cancer patient is there, right? Let us take the worst example. He has gone through chemo and he's all said, "Arey bhai, aapka advanced cancer hai, kuch hone wala nahi hai. Abhi aap jao ghar pe, khana khao aur intezar karo." And such a person takes CBD oil. First thing what happens is he forgets he has a disease. Immediately that thing comes because of the neuroprotective ability of CBD oil. And he starts smiling and laughing. So for such people, it is needed. But for the people who already are healthy and they have a good healthy routine, for them, why do you want anything? Not just CBD. Why do you want any stimulant? Now right. The routine mild stimulants that we use like tea, coffee, that should be fine enough. So if you do like that, yes, I would say that CBD can be addictive.
Okay. And once one starts taking CBD, for example, for a disease or some kind of a problem, then does it have to be continued for life?
That is a very interesting question. Again, it is a very common question that people ask me. Okay, but then again, first you have to understand the nature of the disease. Like for example, the chronic pain, fibromyalgia. We really don't know at what level it affects and how deep it affects. So what we say is, because there are no particular tests for that pain to identify. But for the pain of arthritis, yes, we have certain tests. Like for example, somebody has rheumatoid arthritis, baat ki bimari, and you have 2-3 tests. So we do the test, we start the medicines, and when we see that the values have fallen, the pain is better, and the person is doing fine, we can always stop. But there are certain diseases which may need very long-term approach. Say, for example, fibromyalgia is one of that. Some of the autoimmune disorders can really need long time. So depending on the disease, yes, it takes time. And it may have to be taken for certain time. But largely, if you say for simple issues, like for example, somebody has joint pains, they can take it for a certain amount of time, say about 2 to 3 months. And once they are fine, they can stop it. It is not going to come back. Because ultimately CBD repairs this thing, the CB1 receptor, the what we call as endocannabinoid system. So once that is repaired, then you're not going to fall back.
So then it doesn't have to be continued for life, is it?
No, you need not take it for life.
Okay. And do you think most practitioners should incorporate CBD along with whatever mode of practice they follow, like
I would love,
homeopathy along with
yeah,
CBD, or Ayurveda along with CBD, or allopathy, for example, along with CBD? If they incorporate these and have an integrated approach, do you think it will help the patients more?
yes, it will definitely help the patients. The first thing is, I think we should applaud the government of India post the COVID episode, that the government of India themselves are trying to tell the institutions, the bigger, be it AIMS, be it Medanta, everywhere you see now they have integrated a department. So first thing is we should applaud that thing from the Indian government. So they've already done the initiative, and they have seen that the future is in integrative approach. Why? Because now we know that antibiotics can be so bad. It can create superbugs, right? So now we know that we need to have this integrated approach so that we lessen the burden of medications. Like for example, antibiotics or chemotherapy or painkillers or even antidepressants, all these things can be lessened. So if we can do an integrative approach, like how I do or some of my friends they do, they have seen really good results, whereby not only the other medications needed are in low dose, but for a shorter duration, because in the background, the CBD oil corrects the cannabinoid system. And once the endocannabinoid system is corrected, that system itself, so it is not just these 2 receptors, you have all this bunch of receptors, and even this side, these receptors also.
Right.
So it's a very big thing. It's a big effect that CBD can create on us. So I'm doing that initiative. I reach out to people. I also reach out to the doctors, educating them on medical cannabis, especially the CBD part, so that they can use. If they use, yes, they can really bring about some good results.
Okay. So,
and also we need public demand.
Of course. So it's only when people will become aware, we'll have more people who will come for this line of treatment.
Yes.
Yeah. And lastly, I want to know that, is CBD helpful in treatment of rare diseases such as muscular dystrophy or MS?
MS is not a rare disease as of now.
Anymore. Yeah,
I
it's
see a lot
becoming
of
quite
people.
common.
Yeah, a lot of people are suffering from. Now, only the thing is that diagnosis is getting delayed. So by the time they diagnose, it is 6 to 8 months. It has passed. That is the only thing. And again, sad to say that we don't have sure shot tests to diagnose these rare diseases, like if you want to put it, MS, ALS, kind of disorders. Yes, CBD does that very well, especially in multiple sclerosis. It takes care of the pain. It can repair the nerves, in the long term. And it also has the autoimmune factor where it can curb the inflammation which is there in the brain and the periphery. Yes. So I say broadly, if you have a pain and if you have inflammation in your body, CBD definitely helps. It may not be curing, but it will definitely help you. And it will also open up resources for the other treatments to come in. Like, for example, there was a very good study which was done in Australia. And most of the diabetic people, they suffer from chronic urinary tract infections, especially that of E. coli. And E. coli is such a thing which is there in us. We need it to manufacture vitamin K. So it's a very common infection, and they use lots of antibiotics again and again, thereby damaging the system. So these people did a 3-month study on people who diabetics who had E. coli infection, and they found that it could control all the E. coli infections in a matter of 3 months. Wow. So there was really sporadic, occasional infection, but largely the recurrent cystitis, as we call it, had already fallen down. So CBD is also the antiseptic. It is as good antiseptic as what we use as povidone, iodine, betadine, for example. So in that case, it can help in such diseases. So all the diseases where there is inflammation, whether the inflammation is less or more, CBD will definitely help you, whether it is a rare disease or a common disease.
Yeah, sorry. Lastly, doctor, I want to know if there are any side effects of CBD.
Yes, that's a good question. So first thing is, that's why first thing you have to take the consultation of a doctor and who understands what exactly is the issue and how it has to be treated. That minimizes the infection, right? And most important things for any disease, so unless you take the cure in your own hand, you're not going to come out of that disease. Every diseases need that approach. You need to take that approach that I'm going to change. Okay, this is a lesson for me that I am sick. Now I will take it upon myself and I'm going to change. First, that attitude is needed, right? And then when you do a proper consultation, you'll get the best opinion. Now, what are the common side effects? The common side effects that we see is dry mouth. So dry mouth, people say that mukh sukh raha hai, naak sukh rahi, gala sukh raha hai. So this is very common because such people, they don't drink enough water. So that is the reason. So by drinking enough water, that takes care. Some people, the BP falls down, especially people who are taking medications. So BP medications they are taking, and you take CBD oil, there is chances that the BP may fall down suddenly. Okay. So that is so because of which you get dizziness, vertigo will be there. You will not be able to walk, in a balanced manner. But again, this gets adjusted in few days. That's why you need a doctor's opinion who understand the BP medications which is given, because not all BP medications they have this. Third thing is some people get constipation, and again, people who get constipation are usually because of dehydration. They are not drinking enough water. Some people get loose motions, and loose motions is not because of the CBD oil. It is because of the detoxification that occurs. So that these are the most common. And some people feel lethargic. For the first 3 to 4 days, you feel lethargic. You feel sleepy in the daytime. So if you are feeling that, you need to drink a lot of water and take rest for a few days, because you need to take rest in order to heal yourself. Right. Apart from this, the rare side effect is what we call as vomiting. So if you take large doses and somehow you are sensitive to medical cannabis, then you start vomiting. And the vomiting is like projectile vomiting. I'll sit and vomit it far. So it is not like just vomiting which is coming from the mouth. It is a projectile vomiting. So if that happens, then we have to say that, so yeah, there is some issue because of which you are not tolerating CBD oil. So the most of the common side effects is dryness, dry mouth, dry nose, dry eyes, dry throat is very common. Constipation is also very common, but then it gets resolved if you drink adequate water. Apart from that, long-term side effects, there is nothing. And the best thing about CBD oil, because of which it has become such a hit in West, is it has anti-aging effects. So as you keep taking, you feel that your muscles and bones are stronger and more, agile.
Lovely. I think all the ladies will want to, get CBD oil. Okay, I think I'm done with the questions. It was really, really nice. Let me see if there are some questions, and there's somebody who even messaged, wants to ask something. So we'll just take up the questions.
Dr. Tahir, my name is Anurag. Can you hear me? Let us come on the question. CBD oil में, what is meant by this potency 4000 mg, 6000? Because I spoke to somebody, then they said कि it is 15 ml, 4000. वो कुछ confusion है. तो वो क्या है? एक तो उसको थोड़ा बताइए, उस पे थोड़ा ज्ञान डालिए प्रकाश. सेकंड क्वेश्चन इज बहुत सारे डॉक्यूमेंट्रीज डॉक्टर साहब मैंने देखी हैं, हाउ टू चेंज योर माइंड, फैंटास्टिक फंजाई. माइकल पॉलन ने बहुत अच्छा काम किया, जो 4 एपिसोड की एक जो डॉक्यूमेंट्री सीरीज बनाई है. सो आई एम इनटू मीडिया, so I watch lots of these kind of series. So he has talked about MDMA, then magic mushroom, peyote, LSD. So how all these 4 things are different or similar to this CBD oil? क्या difference है दोनों में? Because I'm very much impressed after watching these 2-3 documentaries. 2 questions.
Okay.
Thank you.
अभी मैं आपको I'll simply say this is a mobile, है ना? So this is the mobile phone. Okay. So when we say weight of the mobile phone, the company says that it is 190 grams. Okay. So sometimes they write without battery, with battery. Okay. But when we put on the weight cover, the weight will increase. Okay. In allopathic pharmaceutical companies, they give you the pure weight of the molecule. Like for example, when we say paracetamol, like paracetamol is 350 milligrams, 500 milligrams, 650 milligrams, 1000 milligrams. It means that tablet has just 1000 milligrams of acetaminophen or paracetamol. They don't put the weight of additives, like they add a small calcium carbonate in that. They add some binding agents, some anti-caking agents, all that. So they don't say. But when it comes to the Indian industry where they're labeling, so this is what actually happens. When they say 4000 milligrams, it is the milligrams in that whole bottle. So I have any bottle? No. Okay. So if you look at, suppose the bottle says 4000 milligrams. So 4000 milligrams, if you look at that, it will be written 2 ways. One is 4000 milligrams of cannabinoids. Means it is like the paracetamol, weight of the paracetamol. And some people, they write 4000 milligrams of leaf extract. It means along with cannabinoids, you have a little waxes, plant waxes and all that. So in that potency it changes. So again, depending on the bottle, which you have to read very carefully, how much the total bottle. So if it is 4000 milligrams per 30 ml, so it means that 1 ml will have 233 milligrams. So then, according to that, you have to dose. I think you should leave that headache to the doctor. So आप डॉक्टर को बोल देना चाहिए कि भाई आप ये सर दर्द लो और हमें बताएं कि कितना कैसे क्या लेना है. So that is first part. Second part is I think fungi are a very interesting thing, and we know like mushrooms, right? Mushroom is also fungus. So this a correlation according to the doctrine of signatures. So in biology, in botany, we use something called as doctrine of signature. कि ये चीज ऐसी दिखती है तो ऐसी चीजों में वो काम आएगी. It's not like the law of similars. It's doctrine of signature. For example, if you want to take the plant by name Chelidonium. Okay, so if you look at Chelidonium, it has yellow flowers, and when you break the flower, you get yellowish fluid. So that's why it is widely used in India for jaundice. People make a decoction of that and use. So that is called doctrine of signatures. So according to the doctrine of signatures, if you see mushrooms or the fungi, they are in between the animals, the bacteria and low level of bacteria and the advanced form of life. So it gives a connection to it. So according to the doctrine of signatures, it should work somewhere at the level of your evolution, at the level of your genes, at the level of your stem cells. So that is what it means according to the biological law. But as such, we have studied a lot of fungus. They have active molecules, like for example, psilocybin. They have active molecules which resemble that of our own 5-HT, so tryptamine. And when we take, it stimulates our pineal gland secretion, thereby giving us a psychedelic experience, an experience which can go beyond the physical realm. So all these things are known as psychedelics, and in India, it is still very. I wouldn't say it is anything is really available. And also, most of the people, they abuse it as a party drug. So again, it comes into that part. But if these are used medically in a controlled manner, in a very really good way, then it has a very deep healing effects. But CBD, it has the effect not only on your mind, but also on your physical body. So both the levels it works. Whereas this fungus or mushrooms or all these psychedelics, they work only on your mind. So sometimes if you have a physiological or physical issues, it may not work. But when it comes to CBD, it works in both the ways. And the psychedelic effect of CBD is less. It can be very controlled effect. That is what I like about CBD.
Like in the documentary, the Paul Stamets, who is the director of the documentary, he has mentioned that one day his mom called. She was 82, and then she told him that Paul, I just went to doctor, and I was been diagnosed with the grade 3 or 4 cancer. So in her breast, there were around 12 to 13, kind of thing were there which causes cancer. So then I think Japan has done a lot, doctor, for this.
Yes.
So they got, I mean, it's on record in the documentary itself, the fantastic fungi. I mean, that excites me a great thing, which helps in the coming future. So as CBD is doing. So his mom, she took for 2 months, and after 2 months, the whole cancer was gone. I mean, this is the power of this fungi. So it is amazing, sir. I mean,
they basically stimulate your stem cells.
Okay.
And stem cells are wonder medicine. And I hope that we get that in near future so that we can also incorporate in our healing experiences.
So he says, hi, ACL rehabilitation and pain management. I'm having lower spine disc bulge. So subsequently, but when I wake up in the morning, I feel pain in my right lower back, and after some physio, pain eases off. My query is why it makes me more hyper, overthinker, conscious, sometimes productive, and also making me sleep. Can you please give a comment on this?
I think this is also because of overstimulation, I think, and also because of the way your work or the job profile is. So it all depends. Now here, this is something called as what we call as reward function. Why do we feel happy when we take CBD oil, or why do we feel overactive or hyper? Is because it stimulates the reward function, shabashi. So when you take CBD, you feel that you are getting rewards for whatever you do. So then you want to be in that mode, in that hyper mode. So what you have to just do is, I think, gently reduce the dose a little and keep yourself well hydrated. If you're not well hydrated, and this can also happen because of another reason is if you are consuming a lot of refined sugars, because refined sugars along with CBD oil, they tend to make a person hyper because of that glutamate toxicity that actually occurs at the micro level. Okay, somebody has asked, can you please name documentaries? One documentary was, I think, Weed the People. Because of her only, I think I was pulled into this because she has explained it so beautifully in that documentary, in the lecture, and also when she explained that I was suffering from a disease which was rare, as we talked earlier, and she took it and she cured it herself. And there she found that the doctors knew nothing. And she, being an engineer and being an explorer, she explored a lot. And that's when she created this Weed the People. You should watch that documentary or Weed the People.
I have a question. May I go ahead, please?
Please do.
I want to know, to get good sleep, can we take CBD oil, and how long does it take to get into effect? As in to get a good sleep, because of, maybe a person is not getting sleep because of overthinking, or some stress. So if we take CBD oil for that, and how many hours prior to the sleeping time should a person take?
I think because there are many formulations that are available for everybody, all formulation doesn't suit. So I think first, if you can take opinion of a doctor, it will be better, because there could be other things like how Mr. Pradeep told. First thing is, usually when we give CBD oil, depending on the condition and the stress level that the person has, so usually we see the action between 30 to 40 minutes. The moment you take CBD oil under your tongue, in 30 to 40 minutes, it starts soothing your mind and you start feeling relaxed, and you tend to sleep. But one thing you should remember, that it doesn't induce sleep. CBD oil doesn't induce sleep, but it can help you maintain the sleep cycle very nicely. So on the day one, you may need the sleeping pill that you always take. On the day two, you may still need the sleeping pill. But from the day 3 or 4, 5 onwards, you need not take a sleeping pill, because it doesn't induce sleep. It doesn't knock you into a sleep. We don't have that oil available in India, which actually puts you into sleep. But it does help in sleep. And in the long term, it modulates the sleep cycle so that you sleep better in coming days.
Stand and it helps to calm your mind down so that you can sleep better in the coming
Yes.
days, from day 3,
Yes.
day 4. That's okay. All
Exactly.
right. And one more question that I have is it also useful for period pain?
Yes. 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 I
And
think when
can
we
it
read
be
the
taken?
history,
Can it be
yeah, when we
taken by teenage girls also?
yes,
As in
yes,
very, very, very the pain to the extremes. So can it be taken by
yes.
those? Yeah.
It is. I think if you look at the history, when what was his name, Dr. William O'Shaughnessy, when he researched, he was the first guy to put it cannabis in a document format according to the modern medicine way back in 1800s. So when he used that thing, he said that I want to take this to treat the period cramps of the queen. So that was one of the indication that he wanted to use it. So yes, in Ayurveda, Unani, even in modern medicine, we use it for the periods pain. It eases out the periods pain. The best thing is it doesn't block the flow. So that's why it is one of the better painkillers.
All right. Thank you so much.
Yeah, Mr.
Doctor, there's one more question. Does CBD help in balancing the hormones in perimenopausal, menopausal, and postmenopausal state?
Yes, yes, it definitely balances the hormones, and especially for menopausal people, it is really good because it takes care of the hot flushes. But again, it is slow and steady action. So, after some time, you start seeing that action, because also it replaces the estrogen hyperactivity, as we call it. So it is really good. But it is not as good as prime dose oil.
I'd like to ask you a question regarding this CBD oil that we're talking about. How effective is it for people with chronic pain? You've been talking about that, but how is it when it comes to diabetic neuropathy? Means can people with diabetic neuropathy take the CBD oil, and can they take it in conjunction with the medications that they're taking, like gabapentin, or is it that you have to take it solely either go in for these medications or you go with CBD oil? Can you just elaborate a little bit on that?
So CBD oil, again, to the neuropathic pain, if there is numbness and all, it takes little time because it has to work on the inflammation in the nerves, and also it helps in bringing down the sugar levels. So ultimately, it is a win-win situation. But in short term, you do need the normal supplements that most of the diabetic doctors or endocrinologists they use, especially what we call as ALA. So that is needed, but this can help in the long term, because with ALA or the usual medicines that are prescribed, as long as you're taking, you feel relief. But the moment you stop, the neuropathic complaints come back. But with CBD oil, it is a slow and steady thing. In about 3 to 4 weeks, you do feel relief, and after that, it relieves you for a longer time. And also it modulates the blood sugar levels. So it is a win-win situation.
Thank you, doctor.
As we come to the end of this fabulous session and such an informative session by you, Doctor, thank you so much for taking out time for us today. It was really a pleasure to have you. Thank you.
Thank you. Thank you all. Thank you for my friends. Thank you for Ishmi inviting, and please continue the good work that you're doing.